Good day, I'm Imelda Williams and I'm going to introduce you to the preliminary image evaluation form. It's really important that you get used to this form as it will be used for all of the examinations of our cases, of our image interpretation cases. So firstly, when you look at the form, there will be clinical indications. So in this case, this patient has had a foot injury and there are these images. Normally the images that you see will also be available in an IQ View folder so that you can manipulate those images. Now it's important when you complete the form that you pay attention to this next section. So for the general opinion, basically when you look at the case, you need to decide whether it's normal or abnormal. And so you need to either tick abnormal or normal, and that will be half a mark. When we come to the specific opinion, that in total is also half a mark. So you will need to decide whether there's any issues with alignment. So if the alignment is abnormal, you need to tick that. Similar with the bone, if the injury sits within the joint, you need to tick that as well, and with the soft tissue. Now to save time, you only need to tick the boxes in the specific opinion that's abnormal. So if we go over this case, for example, we can see in the wrist that something is going on, especially here on the lateral view, where we can see that is the lunate, there's the radius, but the midcarpal bones are all posterior. So the capitate is posteriorly to the lunate. So it has affected the alignment. So you would tick for abnormal for alignment. In this case, there is no fracture to the bone, so that would be normal, so you don't need to worry. You can just leave that open, but if you want to, you can tick that. And then because the abnormality is sitting within the wrist joint, you also need to tick cartilage and joint. There is not really major soft tissue issues here, so that would be normal. So half a mark overall for these tick boxes. Then for the overall comment, that is 1 mark. So you need to write a very succinct comment, and in this case it will be a perilunate dislocation. So if you now look at the marks, you'll be able to see that for each case the total marks will be 2 marks. Okay, let's look at another case just to go through this again. So for the second case, we have a spine, and in this case the patient was in an accident and the head was forced against the windscreen, and the patient is now complaining of a very tender neck. So again, I've indicated the total marks for this case. So if you look at the case, you are able to see firstly that there's a fracture in the posterior arc of C1. But if you look at the open mouth view, you can see that the lateral masses of C1 is overhanging the lateral masses of C2. They're not aligning. And that is very typical of a Jefferson. So this is a fracture of C1. So in terms of how you should then score, so the general opinion is abnormal, so that would earn you half a mark. It has affected the alignment because your lateral masses are not lining up. So that's half a mark. There is a fracture through the bone, which is half a mark. And of course, this is sitting within the joint space. That's abnormal, but there's no soft tissue abnormality, so you don't need to tick the soft tissue. And your overall comment should be that it is either, you can either write a Jefferson fracture, or you can say fracture of C1 plus posterior arc of C1 fracture. And then you can see how the marks has been attributed. So make yourself work through this again and again so that you are 100% sure how to use the form as you go through the unit. Thank you.